Don't get excited.
Now you know why I don't want to be chair.
Well, you wanted to be chair when she wasn't here.
Well, wanting to be and getting elected are two different things, I'll tell you that.
I will officially call this meeting of the Seneca County Board of Commissioners to order for Tuesday, July 14th. Please join us for the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Join me for the prayer. Lord, thank you for this day and for the ability to come together as public servants to do our duties. And please be with us with the decisions we make. And we understand it's thy will be done. And if we need to build that ark, I guess that's what we'll do. But we can shut it off at any time in Seneca County. In your name we pray, amen.
Amen.
Roll call.
Commissioner Stacy?
Here.
Commissioner Zoller?
Here.
Commissioner Kirschner?
Here.
We'll have the signing of the journal and they'll accept a motion for the minutes, the approval of the DVD recording of the previous session, Tuesday, July 7th, and the index.
So moved.
Seconded.
All those in favor say aye.
Aye.
Approved. Okay. Any adjustments to the agenda? Okay, seeing none. We have an introduction of our new director for the Mental Health and Recovery Board, or for the office, not for the board, for the services. Yes.
Yes.
All right.
Thank
Welcome, and thank you for coming to our meeting.
you. I met some of you guys already. My name is Mircea Handru. Effective July 1st, I'm the new executive director of the Mental Health and Recovery Services Board. I wanted to come and introduce myself. I wanted to come and thank you guys for continued support of the Seneca County Mental Health and Addiction Levy that we have going on, that we fund services here local for Seneca County residents. And maybe give you guys a little summary of what we exactly are doing in the community, how we can serve Seneca County residents, maybe tell you a little bit about some upcoming projects or services that we are planning to fund here in Seneca County. So that was the purpose of my meeting.
Yeah.
Currently through local levy funds, we fund services in counseling services in 4 local Seneca County schools, Tiffin City Schools, Fostoria City Schools, Seneca East, and Old Fort. We are doing prevention services in more schools. Also in all 4 local schools, we are doing a drug screening for students there. We are offering and funding behavioral health services at the Juvenile Detention Center, as well as behavioral health services at Adult Jail in Seneca County. Some of the local levy funds also fund crisis 24/7 responses to the ER or through hotline, which is our 1-800 number, as well as housing or inpatient services for clients with severe need at NOPH in Toledo. Currently working on fighting, I guess, trying to work on recovery services for individuals with opiate addiction. Working on a contract for detox services out in Glen Bay, which is the east side of the state. We send some individuals there, then we try to bring them back in the community 16 days later and put them on Vivitrol, and also try to support them with housing or employment services. This is one of our newest projects that we start. It's fairly expensive because Medicaid doesn't pay for detox, and it costs us approximately $9,500 per individual for 16 days. We just started that approximately 6 months ago, wanting to keep track of the success rate. Unfortunately, these clients are not mandated to stay and complete the whole detox program. So we realize approximately 50%, not quite, but around 45% or so don't necessarily complete the detox and get to the first Vivitrol injection. Another medication-assisted treatment for opioid abuse is Suboxone. We at the moment don't offer that to our clients. Those are really the 2 options right now, Suboxone or Vivitrol. We are looking as a board as a Suboxone option. We try to look more into it before we make a decision if we're going to fund Suboxone or not. I'm not sure if you guys are familiar with the difference between Suboxone and Vivitrol. Suboxone, it's more like a strip pill format that they gotta take it every day. It's kind of half narcotic, half a blocker, kind of. It's somewhere in the middle. The individual can still cope, can still keep a job. They will still test positive for that. Vivitrol is a blocker. You start with naltrexone, which is a pill format, the first few days to see if the body has a reaction, allergic reaction to the individual. The individual needs to be clean for at least 7 to 10 days. If not, going to go into withdrawal right away. And if the individual doesn't have a reaction, then it's a once a month shot, which is a complete blocker. What that means, if the individual gets the shot today and tomorrow they inject heroin, they won't feel the high. But if they inject again, they still don't feel the high, but they can overdose. So it's a risky thing as well. At the moment though, we chose with Vivitrol because it doesn't have a street value. It has to be administered by a physician or a practitioner nurse, where Suboxone has a street value at the moment. And it's pretty expensive and it's being used on the street and all those kind of things. So we try to kind of stay away from that. So that's one of our newer projects that we are trying to implement. We see a high increase in need for youth and students. We're also offering a youth mentoring program through Seneca County Family Children First Council. We see a higher need there for youth where parents are either incarcerated or they are start using alcohol and drugs and tobacco at a very early age. We see a high increase in crisis services. That's probably our biggest increase, where therapists have to answer 24/7 to a ER where a crisis happens. And in our 3 counties, before we used to have 1 person on call all the time, 24/7. We are moving to 2 individuals being on call 24/7 because many times an emergency would happen at Tifu Mercy, and at the same time an emergency would happen in Bellevue and one in Upper Sandusky. So then the individual had to wait in a hospital for 6-7 hours before you can even see a therapist. And then once you see the therapist, usually these are pretty serious mental illness that some of these individuals go through, and usually has to do with suicidal thoughts and all that. So we have to figure out if we either can create a safety plan for the individual or try to find transportation and hospitalize them. That is really our biggest cost right now, that the services that we fund the most and really eat the majority of our budget. With the current budget that was approved by the governor, we see approximately $226,000 in cuts, unfortunately, for 15, moving in fiscal year 16, starting July 1st. Some of these services could be a risk, a little bit of needing to reduce them. Again, it's really important to thank you guys for support of the levy. Now we do have levies in all 3 counties. In Sandusky County, we just passed the levy last year. We didn't have a levy there, because the 3 levies in our 3 counties count for approximately 50% of our entire budget. So without the levy, we'll really be into a really big crisis situation with the services we offer. Do you guys have any questions for me? I was trying to be very simple and not complicate things, but I can tell you guys and get into details of services and programs that we offer and all that. Really, the opiate addiction, it's a big issue in Seneca County, but also the alcohol, it's a big issue that maybe is not necessarily on the first page of the newspapers, but it's the same as suicide. We actually keep track of suicide deaths right now, and if I recall correctly, in the last 3 or 4 years in Seneca County, suicide rates are actually above overdose rates. Even if the overdose cases make the front page of the newspaper and the suicide might not, we still have a big problem with suicide rates in Seneca County.
Now, when you're talking about opiates, you're talking about specifically heroin and
Heroin, prescription pills.
prescription drugs. What is the biggest of those 2? Heroin is the biggest problem?
Heroin is the biggest problem right now, yes. And I'm sure probably Commissioner Zoller kind of updated you guys. With the leadership of the local judges and some law enforcement, we started a Seneca County Opiate Task Force. We just had our 3rd meeting where we try to work with the courts through the system, see how we can help individuals with treatment that come through the courts. They are incarcerated in jail for a period of, let's say, 30 days. What can we do for them when they get out? instead of them getting out and reusing again, reoffending again, being back in the criminal justice system on taxpayers' money. How can we use the taxpayers' money maybe into some treatment services that won't bring them back into the same circle?
Now, you talked about approximately 45% of the people not making it the full 2 weeks.
So far, we just started this 4 or 5 months ago. We kind of
Okay, so you don't really have
these
a lot
are not
of-
court order individuals though.
Okay.
These
But
are
of those 55% that do make it, return users, how many do you think?
no. So far, 55 is what our success rate is. They are continuing to stay clean. The Vivitrol program runs between.
But we haven't had enough length to really know.
Correct. We have only 4 to 6 months of data. We're gonna keep them up to 18 months on the shot and then hopefully weigh them off.
How do you monitor that other 55% that did go through the 60 days?
Who did not, or who did?
Who did make it? How do you?
The treatment program they are part of, it's an 18-month treatment program. So they continuously see the agency once or twice a week.
Okay, let me ask it differently. After the 18 months, so they continue to monitor?
18 months is what the Vivitrol program is, which is the shot itself.
Okay.
You understand what I'm trying to
Yeah,
say?
right.
Then they'll probably still continue an aftercare program with the agency, and eventually we're gonna weigh them off. After 2-3 years, we don't really keep them as track. Sometimes phone calls, the agency try to follow up on them. We have a vocational program for job services, so we try to keep track of them for also 2 to 3 years. But after that, we just gotta see if they are back in the system.
How does the 55-45 compare to other programs across the country?
Everybody does it a little bit different. It is a higher success rate if you have in the program individuals who are mandated to be to the program, who are into the criminal justice system. These are individuals that are not through the criminal justice system. These are volunteers in the community who realize they have a drug addiction and they need help. So when it comes to that, it's pretty normal, around 55%.
Thanks.
Appreciate you taking your time to come in. The new office is working out well?
Yes. No flooding yet. I really appreciate your time, but if at any time Commissioner or anybody has any questions, please let me know.
Yeah, I was just thinking of something that, give me a break. You know, we talked about at the meeting that I would see if we could get some funds from the commissioner. We're not allowed to do that because of, you know,
But yeah, he came in
where we
after.
stand. We talked about this right prior to you getting here today, and I volunteered to have people, they want to call me if they want to make a donation, where we could, as a separate citizen. But I wonder if that number is better off to be your group. We're going to need some sort of,
I want to make it very clear, as the Mental Health Recovery Service Board, we don't advocate any way for or against legalization of marijuana. All our focus is the Mental Health Recovery Service Board is to educate the public on drug prevention. Just like the way we do with other drugs or tobacco or alcohol, we're trying to do with marijuana. We provided some local trainings from some individuals who came from Columbus and somebody from Michigan who already saw the impact of marijuana in the state of Michigan. They did a local training, actually 2 here in Tiffin. We are willing to bring them back just to educate the public. Again, we are strictly not advocating either way to vote for or against legalization of marijuana. We're advocating for education on drug use.
Do you know of any organization locally who would be campaigning against the use of marijuana or legalization of marijuana?
I will contact CARSA Coalition, and I can put you guys in contact with
I'm
that.
thinking maybe Freddie, if that's,
yeah, I just wondered, so maybe we need to strike that until we,
Take his phone number out of the paper.
yeah, until we figure out a.
Correct. And I can help with that. There are actually 2 billboards already in Seneca County that educate the public about the dangers of using marijuana. However, even with that coalition, because they receive state funds and federal funds through different grants, they cannot advocate either way. What they will do, they will strongly put a lot of efforts in the next 6 months to educate the public on the risks of marijuana use, as well as labor and employment.
just to follow up with Commissioner Zoller's question and his concern, if there was a statewide organization, do you know if money came from a specific county that money then would be used for campaigning against the legalization of marijuana within that county? I mean, could those funds be designated to be used just here? Do you know that? I wouldn't expect that you might not, but.
Correct. I think I understand what you are trying to say. Statewide, I don't know who can exactly say unless it's a private or donations that I'm campaigning against it. Locally, we fund CARSA Coalition to educate the public. It's just different language to educate the public about drug use and abuse. So they actually do have some funding and budgeting more funding through November or through the end of the year, and even continue after that to educate the public. Drug Free Action Alliance is out of Columbus. It's kind of the big umbrella for coalitions in the state. They do drug and alcohol prevention. I know their focus is really on the same topic now, but same with them, their focus is to educate not just drug prevention, but also how this can impact labor and employment. The 17-page language of the bill for Responsible Ohio, it's public information, and they try to educate the public on what exactly you are voting on if you read the 17 pages.
Right.
And it's a lot of, again, we're not advocating yes or against, it's just that Drug Free Action Alliance can provide local trainings, sometimes at no cost, to different counties or different organizations or different groups, just to try to educate about what is going to be in November.
In your professional opinion, would the legalization of marijuana cause more widespread use of other stronger drugs?
Yes, I mean that is not necessarily for legalization of marijuana. I'm answering this is just through the data we collect. We know the youth in schools using marijuana, they're more likely to turn later on to other heavier
I mean,
drugs.
they always call, they call marijuana the gateway drug.
Correct. No,
And if it was more readily available, would that cause more serious drug use?
I'm sure it will. Also, through the studies that we are seeing right now, the THC level in marijuana today compared to 10, 20 years ago, it's way different. It is more addictive drug today, marijuana, than what it used to be 10 and 20 years ago. And I know in Ohio, Responsible Ohio are, and I gotta be very careful what I'm saying, because again, I'm educating, I'm not advocating, I'm not telling people how to vote or anything. We're not allowed to do any of that. But it's medical purposes as well as recreational purposes. Medical purposes in a language, there is a section where it talks about discounting marijuana for people with welfare cards that needs to be taken a picture in consideration. The state is trying to change the constitution through the vote. However, as a federal law, it's still a Schedule A drug. Recreational marijuana, it's a little bit different language where individuals can grow home up to 4 plants and 8 ounces of marijuana. I don't know if you guys kind of imagine how much that is, but we actually have a video I just posted on our website. 8 ounces is quite a bit of marijuana. Up to 1 ounce can be donated and exchanged at any given time. So I don't know how kind of impact that law will make to law enforcement, trying to enforce what kind of laws. But again, I'm not trying to advocate one way or another. I'm just telling people it's probably a good idea to try to read what is there to educate yourself, everybody, not just us, but everybody in the community. I know there are cities in the state that passes ordinances, and I told Commissioner Zoller, that passes ordinances already. They said, if this is to pass, this is how we are trying to save our community or our city, I guess. Because right now in the bill is no language, or is very little language about where the shops can be open. I know it can be open approximately 1,100 shops in the state of Ohio, which are more than 4 times the number of Starbucks in the state of Ohio. So that is how much it can be open, 1,100 something, I don't know the exact number. So I don't know, again, what the county commission would like to do about it. So what we as the board want to do is just educate, just saying we educate about mental illness and other drugs or alcohol, try to educate about this. I can't predict what is going to happen. As the Seneca County Opioid Task Force, we were looking about passing a resolution, but I don't necessarily want to talk for the group because I didn't tell the group that I'm going to come here and talk about the group, so I don't want to do that.
Right.
But we are looking maybe to pass a resolution about marijuana legalization. If we will pass the resolution in our next month's meeting, they will be available. And again, part of the opioid task force are the local judges, both common pleas and Tiffin Municipal Judge Marrap, Chuck Boyer from Tiffin Police Department, Seneca County Sheriff, DJFS, Health Department, Mental Health Board, Commissioner Zoller, treatment agencies, Adult Parole Authority, probation officers. So it's really, we have somebody from the faith-based organization. We're really looking at more than just treatment, but also recovery supports. How can we involve the individuals with maybe a faith-based organization? What about transportation? What about jobs? What about housing? We're looking at these kind of things. But again, the task force are going to look at the resolution maybe next month and try to finalize the resolution. They will probably make public. And I will share that with you guys.
I didn't realize that. So you're kind of in a delicate situation. Your firm, your organization is not, you're strictly for education.
Correct, we cannot
You
advocate.
cannot advocate or.
That is
or-
correct. We receive federal funding that does not permit us that if, hopefully the newspaper will be careful what they will write, but if that is to be public that I'm advocating, we can lose our funding. So no, we don't advocate. All we do, we educate about drug prevention.
But the opiate task force can express an opinion in opposition of legalization.
Correct, if the group decides, but again, I
If
don't want to necessarily talk for the group. I didn't give them a heads up that I'm coming here today. I don't want the judges to call me tomorrow and say, hey, what did you say?
Yeah.
Correct. So as a board, we cannot take, we cannot advocate. We will educate. So same thing with any political party. As a board employee, I cannot advocate one way or the other. We're strictly focusing on mental health and addiction services to educate about them. This is our prevention as well as treatment and recovery supports. We did posted educational information, a lot of it on our website, and I can share it. We will be present at the Seneca County Fair, try to educate individuals, give them educational one-pagers that they can take with them. We actually saw a really nice video that working partners, an agency from Columbus did. They are focusing really on labor and employment. How can this impact manufacturers in the county when it comes to drug testing, okay? Because now they have a medical marijuana card, but they are a driver and I drug test them and now I want to fire them, but I'm going to have to go through a lawsuit because, okay, so they just did a video where they posted 8 ounces of oregano on a big bowl and see how that looks. And you can have that with you now if this law will pass. We're thinking maybe do something like that to the Seneca County Fair.
There have been some unintended consequences with that. I mean, like CDL licenses, for example, in Colorado. As we all know, if you have a few drinks and you get tested 24 hours later, there's no indication that you're
Correct, but
drinking.
marijuana stays in your system.
Yes, and then the question is, are you using now or?
Correct. And there haven't been anything yet to determine with marijuana when did you use it. Did
Sure.
you use it 24 hours ago or did you use it a week ago?
Exactly. That's
So
what
that-
I'm saying, yeah. For a CDL license, they have random checks and, you know, a guy theoretically could have used it a week ago and he was clean when he was driving, but there's no way to indicate that.
Correct.
It's pretty tough stuff.
So it's something that, yeah, we, obviously it's on our radar to look at. Thank you.
Thank you very much.
Thank
Appreciate
you.
your time. Yes, we will continue. That'll take us to, we do old business. And what's listed here is board meeting time for the meeting on July 27th, so the meeting in 2 weeks. That's, you know, we moved it to, potentially moved it to Monday and also looked at the Friday meeting if needed for the end of the month, because we usually have the last Thursday meeting. So the question is the time for the 27th, you're out, right?
27th, I will not be here.
Okay.
And I will not be here. 27th, oh, Monday, yes, I will be here. But if we have it on Monday, I would prefer to do it at, because I have commitment, I gotta catch a flight. I'd prefer to move the meeting from 10 to 9,
Okay.
if we decide if we're gonna have a meeting on that Monday. Or do we want to wait till the 31st, which Commissioner Kirschner will be back then?
The 27th is the fair opening at 8, the ribbon cutting of the fair. Now, if it's before that, I mean, there's no issue being back, but if they have to rain delay it, move it inside, I don't know if that holds anything up or not.
You say,
And we'd have it-
yeah, we talked about that, but you say you can't have the meeting on fairgrounds anywhere?
No, you can't do that.
Okay.
Has to be, unless the fair's gonna open up for free.
Oh, that's right, because the public's gotta be able to get in.
Yep.
Yeah, yeah.
Uh,
I don't think they'd like that idea.
My suggestion would be just to hold the meeting on the
I think
31st.
we can buy Tom a pass, we'd be set.
Yeah, you guys get press passes anyway, don't you? So that's,
It'd be amazing how many people would want to come.
yeah,
Everybody
yeah.
would
I
know if
would-
we're gonna buy the pass.
My suggestion, Madam Chairman, would be to go ahead and have the meeting early on Monday, whatever time there is, because then, you know, if you need one, you can always set it up for Friday, but Friday would be the last possible day of the month, in case
Good.
something would happen.
True.
So,
I mean, we may not have a lot of business anyway with fair going on in July. We could put notice out to the county offices that we could not have one that week at all, and just let them know that, hey, this will be our last board session for the month, if you need anything.
The 21st.
Then our first meeting in August is the 4th.
That's up to
well, I
you.
mean, the
That's
other
up to you.
alternative, whatever you guys think, but the other alternative would be to have the 21st meeting and then schedule a meeting at the end of that week in case we need another one, and then take off Fair Week.
21st is our night meeting, our quarterly night meeting.
Right.
And we're in Attica.
Yep.
We're in Attica, at the village building,
At
at
7.
7 o'clock, yeah.
We could have the meeting the 24th if you're worried, if you're concerned with conflict with the fair.
Or not, you know, you can schedule that in case there's a need for one. And if there isn't, we could just go ahead and not meet the week of the fair.
Do you think we're best, Stacy, to put one in the end of the week of the 20th as a temporary, or just to, yeah, do the opposite, plan 9 o'clock on Monday, if need, have it, and if we end up not having anything has to be addressed, that can wait until the first August meeting, we'll just cancel it?
Yep, I agree with that.
Yep.
All right, so let's tentatively schedule for 9.
9 o'clock on the
9 on the
27th.
27th.
And then 10 o'clock on the 31st, and if we don't need them, we won't have them. Or just cancel the 31st
Let's
altogether.
just cancel the 31st altogether. Let's assume we can get it taken care of by the 27th. Oh, yeah, versus the other way around. Let's just do it that way, and now that we've done it.
Okay.
Okay. So next Tuesday, 7 o'clock, Attica, Village Hall?
Yes,
Correct. Yep.
yes, that's what I have.
Okay. And then the 27th at 9 a.m. here. Okay.
You do have a conference call with Sandusky County, the 21st at 10:30.
AM?
Yes.
Oh, okay, so we have to go into session on the 21st at 10:30.
Yep, for a conference call for one of their ditch hearings.
Yeah, if
Do
they
we
don't,
have strategic planning at 8:30?
8:30. Yep.
Okay.
When's that?
Strategic planning's 8:30 on the 21st. Is this another digit?
Yep, 8:30.
Yeah.
Yeah, it's
Here,
just like the
or
ones
that's-
we've been doing with Wyandotte, and
Yeah.
we just call in and
Is that here or is that gonna be at the fairgrounds? Civil Defense Building?
Strategic planning?
Yeah,
we'll be out there.
Yeah,
Out there,
it's the same place, yeah.
8:30.
Yep.
Yeah.
And so then we will go into session out there at 10:30 with them, or we'll be back here?
We'll probably be back here.
Okay. 10:30 session. Just for that hearing.
Yeah. Should only take a couple minutes.
Commissioners' meeting will be at 10:30 here.
Yeah,
Is that what you're
a real
saying?
quick
Yep.
meeting.
Just
yeah.
for a quick,
and it could get canceled. If the guy over there waives that, then it'll be canceled.
Okay. And then we'll, regular session, 7 PM.
yep.
Okay. All righty. Says to, unless there's any other old business? Okay, it says to new business. We've already talked about the opiate task force, we did that in work session, correct? Okay. Bill vouchers then.
Okay, I have bill vouchers batch 3416. I have a resolution authorizing an appropriation adjustment within the general fund, moving $3,696.63 from workers' comp to the Veteran Services Flags line. Our workers' comp has been paid for the year, and since they had some funds left within their budget, they'd like to move that to their flags line, obviously to get flags. I have a supplement to the permanent appropriation for the general fund for 2015. This is at the request of both common pleas courts for court reporter, transcripts, and professional services line. They put $30,000 in at the beginning of the year, and they've gone through quite a bit of that, and with anticipated cases throughout the rest of the year, they've asked for an additional 15. And that is to go into their court reporter transcript line of 15,000. I have a supplement to the permanent appropriation for the general fund. This is for the Stantec Professional Services Agreement, the new, not a new program, the last project that was initiated with the home, buying the home with, what is her name? Tice.
That's the airport.
The airport, yes. So we have to get the contract in place for that. That's for $23,120. I have a supplement to the permanent appropriation for the Delinquent Care and Custody Grant Fund, putting $1,500 into PRS, $20,000 into their transfers outline. A resolution authorizing the fund transfer being made to the Delinquent Care and Custody Fund, moving the $20,000 from their 159 account to their 162 account. There's changes in July. I have a supplement to the permanent appropriations for the Public Assistance Fund, putting $18,566.17 into their other expense. I have a supplement to the permanent appropriations for the Foster Children Donation Fund, putting $1,000 into their other expense line. I have a resolution accepting the resignation of Bailey Hickman as an intermittent maintenance worker for the Seneca County Maintenance Department through the TANF Summer Youth Employment Program. This individual is working with Job and Family, running it through our maintenance department, and didn't want to be with us anymore.
They all finding better jobs, that's why they're all leaving us?
Must be. I have a resolution authorizing Seneca County Board of Commissioners to enter into a contract with Lake Erie Construction Company for the 2015 LPA guardrail upgrade. I have a resolution authorizing Holly M. Stacy, President of the Board, to sign the Ohio Public Works Commission project agreement for the Ohio Local Transportation Improvement Program. A resolution authorizing Seneca County Board of Commissioners to enter into a contract agreement with M&B Asphalt for the Seneca County Road 10, County Road 35, and County Road 61 pavement resurfacing program. And I have a resolution authorizing the agreement contract with Pictometry International Corporation for the digital aerial photography, Seneca County, on behalf of the Seneca County Auditor, and authorizing the President of the Board to sign this and other related documentations. And that's all the resolutions I have.
Do I have a motion?
Make a motion that we approve those resolutions as discussed.
Second.
A motion and a second. The resolutions as discussed, as presented. Any questions?
Yeah, is this part of GIS, this overhead pictometry?
No, it's in her regular schedule. Every so many years, they refly. It will help it'll be used, but they refly it to get accurate.
It's not part of the GIS database?
I suppose that aerial stuff is what she uses on her website, which is all the GIS stuff, yes. Yeah, yeah.
I have a call into John Navoli at the COG as they're doing this study for the GIS. I understand after speaking with some of the stakeholders that their concern is the study's being conducted, should we have GIS or not? That was not my understanding. My understanding of the study was that we knew we had to have GIS, and it was how we were gonna govern it, how it was gonna be run, and blah, 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 so forth and so on. So, again, this is just to hear what I'm hearing from some of the stakeholders, so I'm trying to get clarification from that, because we're not gonna, this $50,000 study isn't to determine if we want GIS. We already know that. It is for those other reasons that I've said. So I'm trying to get some clarification on that, but John's been on vacation. He'll be back tomorrow, and hopefully I'll have an answer for that, because am I right on what my assumption is here? It is to deal with more governance, how this program's gonna run, not if we want it or not. I thought we were way beyond that.
This is recording. Fred is right. That is. Sorry, I was thinking your time. You're asking me right. Yes, yeah, that's my understanding as well, is that the study was going to determine, you know, in the grander world of GIS abilities, you know, who needs what can be done, what can we do because we would have that technology accessible. And what that looked like, not a matter of have it or don't have it.
Yeah.
We already have it and we're not gonna live without it.
Mhm.
It is a matter of the greater good of the county being able to reap benefits from it. Is that need there, that interest there? And if so, my concern at the end of it is just gonna take a big pot of money, but, you know, I wasn't thinking it was a yes, no question, so.
Okay, then
My opinion.
my assumptions are right then, for once in life.
All right, we have a motion and a second on the floor, no further discussion, roll call.
Commissioner Kirchner?
Yes.
Commissioner Zoller?
Yes.
Commissioner Stacy?
Yes, approved. All right. Brings us to an opportunity for citizens' comments. Anyone have any comments? Okay.
Nobody else wants to pick on me?
See. Not on record.
Poor little
Not on
Willie.
record. Well, then I'll take a motion to adjourn, and then we'll let you pick on him.
So moved.
Second it.
Moving second to adjourn. All those in favor say aye.
Aye.
We stand adjourned, 2:37.